We have a lot of patients ask us about snoring and sleep apnea. We don't do sleep apnea. We really should feel that a patient should go to a sleep center and be treated for that because that can be a dangerous situation. However, we do work with snoring. We do a snore guard, which has worked really well. It's an appliance, kind of like a night guard that goes on both the top teeth and the bottom teeth. And we've had patients request that. It has some little attachments that hold the jaw open slightly, and patients will call us occasionally and say, where can I get more of those little attachments? This is working great. So it's been a success in our office.